Hi everyone, Dr. David Kulla here. If you have shoulder arthritis, you may have had a shoulder subluxation for a long time. Arthritis doesn't happen overnight. So David here has been seeing me for a long time for wellness care, and he was just diagnosed with shoulder arthritis. So what we did, and he never had any shoulder pain ever, right? Until recently. So he never complained to me about shoulder pain in all the years I've seen him. And if we take a look just like this and if you zoom in there, you'll notice that one thumb is much lower than the other, okay? It's a couple millimeters, so it may not seem like a big difference, but that will throw the shoulder off. And it's this shoulder, correct?
Well, actually, I have arthritis in both shoulders, but this is the only one I have pain in.
Okay. Yeah. And show me what hurts, what motion hurts there.
If I reach down and out at the same time.
Okay.
Yeah.
And what about if you bend this arm and raise it up? Can you do that?
I can do that with very little pain.
Okay. All right. So we're going to correct that clavicle for starters. So go ahead and lay on your back for me. I guess you had 2 sets of x-rays done on both shoulders. Okay, let's have you stand up right over here. And we just did some really light adjustments there to his clavicle. And there we go. Okay, go ahead and raise this arm up a little bit for me. Okay, and drop it down. That's a little bit better. But my guess is you probably have a little bit of adhesive capsulitis in there too. So what I want you to do is sit on this table but face that way. And then you'll, when you're facing that way, take your shirt off. And we're going to show you how we treat arthritis. What we do is we use cold laser therapy. Cold laser reduces inflammation from arthritis anywhere in the body, not just your shoulders. But it's a really great tool, and we're going to sandwich his shoulder. We're just going to do this one shoulder just so he can see the difference between the left and the right side. And his back is really red right now because we just gave him heat and he was just adjusted. Okay, so this shoulder's worse, the one that you can't raise or lift. And this laser is not painful at all. You won't feel anything, David. And with one treatment, you'll see that he's able to raise his arm higher. He almost had it to shoulder level, just shy, maybe about 5 degrees shy of shoulder level. So we're going to test it again right after we do the laser here. I'm sandwiching his shoulder with 2 lasers so we could speed the process up and you guys could see the results faster. Okay. And did they say where the arthritis was? Was it in the glenohumeral joint, the AC joint? No, okay. When you get a chance, try to forward me those x-rays or the report, okay? This laser that I have here on top is a 25-watt laser. The blue one I have here on the front of his shoulder is a 50 watt. So this blue one I can move a little bit more frequently. The treatment times are quicker. Yeah, so what this does is it makes a cell wall more permeable, allowing fluid to leave the cell, which is inflammation, and nutrients to pour in, speeding up the healing time and reducing the inflammation all at the same time. We're going to test it in just a minute here. Have you done anything for your shoulder yet?
No.
Okay, so you just had the x-ray done and that's it. Okay. So luckily what we can do here for David is we can send him home with a cold laser. Unfortunately today they're all rented out, but we should have them back next week. And you would treat twice a day from the comfort of your home, and we'll show you how to use it. It's pretty easy, okay? And they just did an x-ray, right? No MRI?
Right.
Okay. And you didn't have a fall or any kind of accident, or did you just wake up this way?
Yeah, I mean, you do have a rather hard mattress, and I'm wondering if maybe that contributed to the problem. But
You woke up that way, though, one morning, out of the blue?
yeah, pretty much, yeah.
Okay. Okay, so right now we're going to have him raise that arm and see if it's as painful. Okay, well, he can go. Look at that. So before you were up to about here.
Yeah.
Go. And all we did was laser, so he was up another 10, 15 degrees. Reach across your shoulder gently. You're able to go a little further without pain?
Oh, absolutely.
There you go. One laser treatment. If you have arthritis anywhere in your body, you have to try cold laser therapy. If you guys have any questions about arthritis, about cold laser, comment below. Dave, thanks for showing, letting us show everybody how that works.